Welcome back. Again, my name is Dr. Ivy Branin if you're joining me for the first time, and I'm a New York-based naturopathic doctor, though in the virtual world, I'm seeing patients all over the states, all over the world. And don't forget to subscribe to my YouTube channel because I'd hate for you to miss any of the fantastic content that is going to be coming your way. And also, don't forget to like this video. So because I talk so much about women's health, and definitely in the last few videos, if you've caught any of them, I've talked about some female issues like fibroids, and today I'm going to be talking about menopause and what women can do to go through the change naturally. So what is menopause? Now, the funny thing about what is menopause is that humans and orca whales are actually the only mammals that go through menopause. And when we say menopause, I think often we think about more the perimenopausal phase, where a lot of the women experience things like hot flashes and vaginal dryness. But what we're really talking about is no longer getting your period, and exactly not getting your period for over a year. And ironically, as women, we actually are going to spend a third to a half of our life actually in post-menopause, so no longer getting our period. And basically the reason that one doesn't get their period during menopause is that a period happens, menstruation happens as a result of ovulation, and as we approach menopause, our ovarian reserve diminishes so much that we eventually stop ovulating. And basically, there's nothing technically wrong with menopause, but a lot of women do experience symptoms. So what is the natural way, natural treatment for menopause? So I kind of almost think, just as like when I'm working with patients that are wanting to get pregnant, they're going through fertility, I really see of the things that you do for menopause, you should be doing decades before. I'm just going to start right there. So first, looking at diet. So probably of all the possible dietary approaches, I really feel that the Mediterranean diet is probably one of the best ones for menopause. It's also the same diet that I recommend for couples that are trying to get pregnant. Why? Studies actually have shown that women following a Mediterranean diet actually do have less hot flashes and other menopausal symptoms. The things that I like about the Mediterranean diet is the encouragement of fresh fruits and vegetables, typically about like 4 to 6 servings daily, lots of nuts and seeds. And if we think about seeds, I think of flax and hemp and chia, because these are all seeds that are also rich in phytoestrogen, so really helpful for menopause. Then fish, and also when it comes to proteins, encouragement of vegetarian proteins. And I know soy is very controversial, but actually soy is one of our phytoestrogens, and for women that don't have issues with soy, soy can be really helpful when it comes to menopause. The other great thing about Mediterranean diet is that it lacks certain foods that are not good for menopause and actually just aren't really good overall, refined carbohydrate and sugar. And why these in particular are not great during menopause is both diets high in refined carbohydrates and sugar, not only are they both linked to heart disease, but they increase insulin, and when you have increase in insulin, you might also have increases in testosterone, which when you're going through menopause could lead to acne and facial hair. And these are things that women just don't want. And then lastly is moderate alcohol. So not having too much alcohol is a good idea when you're going through menopause or just all the time. And so I typically recommend for patients no more than 3 drinks a week and no more than 1 per day. The other big part about transitioning through menopause is stress reduction. whether it's using techniques like meditation or breath work or yoga or journaling or even therapy. Really reducing stress is really important, specifically because we want to reduce cortisol levels, because when our estrogen and progesterone are at nice healthy levels, it helps to counter out most of the negative side effects of cortisol. So we want to keep cortisol down. And then studies have shown that women that are less stressed, less anxious, have a better well-being, tend to actually have less symptoms when going through menopause because they have a better outlook. And then last would be definitely exercise. So exercise is going to be really important. First, because as we age, and definitely menopause is one of the first markers of aging in women, you're more at risk for cardiovascular disease, dementia, and osteoporosis, osteopenia. So definitely exercise is going to be really important for that. Also for weight management, mood, and thyroid function. So what kind of exercise? I definitely recommend incorporating some weightlifting or some lifting of weight and kind of weight-bearing exercise for bone health, and also building up lean muscle mass, because the more muscle mass you have, which you end up losing if you don't use it, you lose it, is going to help promote weight maintenance and weight loss if necessary. Also, balance exercises. So I love like Pilates and yoga, dance, and core exercises, anything that's going to really build up your core. Again, this can really help specifically when it comes to osteoporosis, osteopenia. And then I guess what to discourage is anything kind of very high impact, or at least not all the time, because we definitely don't want spikes in cortisol. So what are some of the supplements that I often recommend for menopause? So first, the foundation. So the foundation being a high quality multivitamin rich in methylated B vitamins, specifically B12. Actually, deficiencies in B12 have been shown to cause hot flashes. So definitely want to make sure you have enough B12, B6 for mood, vitamin C and vitamin E, also really important when it comes to hot flashes. Vitamin D, specifically if you are deficient, because it's going to be helpful for osteoporosis, and it's going to help also with mood and cancer prevention. Outside of that multi, I'd say specifically if you do have a family history of osteoporosis, osteopenia, definitely want to take some calcium. I also recommend taking fish oils, one for mood, but also for it's anti-inflammatory, really good for hot flashes. A probiotic. Probiotic is really important, specifically, and if you want to really learn why, I definitely recommend checking out my YouTube video on urinary tract infections, UTIs. So actually, when we go through menopause or after menopause, because estrogen drops, this actually causes changes in our vaginal flora and makes us more susceptible to urinary tract infections and bacterial vaginosis. So choosing a women's formulated probiotic with Lactobacillus reuteri and Lactobacillus rhamnosus is so vitally important. Now, of course, now you're wondering, what about herbs? So if you've watched any of my videos, then you already know that I typically like prescribing a variety of herbs. But in this case, though there are a lot of herbs that I like, there actually is one herb that I love, and I will even sometimes prescribe it just alone, and that is maca, also known as Peruvian ginseng. And basically, maca really helps to stimulate estrogen and can be very powerful with hot flashes. I mean, I actually have seen in my practice, just by giving maca for 2 weeks, dramatic change in hot flashes, vaginal dryness, mood, libido. Now, if you are going to do maca, you must use the gelatinized form, because that is the most powerful form. There's a brand that I like called Feminescence, and that's typically the one that I usually prescribe for my patients. black cohosh, which you might have already heard of, also is very effective when it comes to helping with hot flashes. And it's even better when you combine it with St. John's wort. So one of the theories around why women get hot flashes is actually how they are related to serotonin, and St. John's wort is very effective in increasing serotonin. And it's actually why, if you're watching this video and you're on a serotonin reuptake inhibitor, SSRI, you actually would not want to take St. John's wort. It's actually contraindicated. Another hot flash herb that's really good is Raponic rhubarb, or Rheum raponicum. Really, really effective. And then last thing, and I didn't really talk about this so much, and I probably should have talked about this, but one of the things when we go through menopause, our estrogen, testosterone, and progesterone decrease dramatically because our ovaries are no longer producing it, but our adrenal glands are taking over. And that's why this next herb, ashwagandha, which you might already know, oh, that's great for adrenal glands, but it's really great specifically for supporting testosterone. And yes, we often kind of, as women, we think, oh, we don't want so much testosterone, but we do need certain healthy levels of testosterone, specifically when it comes to vaginal lubrication and libido. So I really like ashwagandha a lot. Not for all women, but definitely women who have characteristic of lower testosterone. So what are also some of the differences between natural supplements and some of the pharmaceutical options? So you probably have heard of hormone replacement therapy, also known as HRT, and there's two different routes. There's conventional, and then you also have what's called bioidentical. And what do we mean by bioidentical? We are talking about hormones that are produced basically taking either soy to make estrogen or yam to make progesterone. So they take derive parts of these plants, and then they go into the lab and they turn them into our hormones exactly. So that meaning that our body metabolizes them exactly. The benefits of bioidentical versus conventional hormone replacement therapy, in addition to that it degrades more naturally in our body, is it actually gives us a wide variety of ways that we can use them, meaning we can actually use a compounding pharmacy and we can create topical creams, we can do suppositories, we can do sublingual, and they all have different ways of getting into the body. And also we know about how actually in many ways oral is not necessarily superior. We actually transdermal can be much more effective. And then also depending if we want it the effects of the hormones throughout the body, or we want it much more localized, like to really help with, for example, vaginal dryness. The other thing that's also beneficial when you compound is that you can actually get the dosages particular to you, and you don't have to worry about certain additives. So sometimes people react negatively to a pharmaceutical, and it's actually not the drug itself, but it's actually some of the inactive ingredients, things like dyes and sugars that actually don't really work for your body. So that's one of the advantages. Now, whether with both though, one word of caution is that for women who have either family history or personal history of female reproductive cancers, fortunately, these are not options for them. And so then you definitely would want to do a natural approach using, looking at lifestyle and diet, but also some of the supportive herbs. Now, one case, if I wanted to talk about, so typically we always think about menopause as something that happens in like your late 40s, early 50s, but there are some women that do go through premature ovarian failure. So we're talking about women in their maybe their early to mid 30s. Now, in that case is definitely a time, unfortunately, I would say, that you would need to either choose to do the bioidentical or the conventional hormones, just at least for a period of time, for a minimum bone preservation. So I just wanted to throw that out, that it's not always like you can't do conventional or you can't do the bioidentical. There's definitely a time period where you really should probably be doing that. So you might be also wondering, like, what is the benefit of potentially, seeing a naturopath? And I actually think menopause, specifically for women approaching menopause, this is a great time because I definitely, first of all, I find that one, there's always like a lot of bad information out there, and working with a naturopath, we can always steer you towards the right herbs, the right supplements that you need, and also dispel any of the myths and the bad information out there. Also, many of my patients come to see me, and they feel that their gynecologist is not really listening to their concerns, and they really don't understand what's going on. So having someone that really understands what's going on and that can guide you through the process, and it's definitely not a one size fits all. I actually could talk on this subject forever, because all women, when it comes to menopause, are going to be having different ratios of estrogen, progesterone, and testosterone, and that's going to have so many different effects. So you really want to work with someone who knows what they are doing. So I gave you a lot of information, and I'm excited, and again, definitely want to make sure if menopause is something you're interested in, please definitely subscribe to my YouTube channel because I'm putting out a lot of new exciting videos. I'm going to talk about menopause and sexuality, and so there's going to be some interesting topics coming up. And if you like this content, also don't forget to like it. Well, this has been Dr. Ivy Branin, New York City-based naturopathic doctor, women's health and hormones expert. Looking forward to seeing you next time.